Posterior compartment or back of leg is the flexor compartment of leg. It is the bulkiest compartment of all three compartments of leg, as it contains powerful anti-gravity muscles. Cutaneous nerves. Skin of the calf is supplied by saphenous nerve. It is a branch of posterior division of femoral nerve. It supplies the skin of most of the medial area of leg and medial border of foot up to the ball of big toe. Posterior division of medial cutaneous nerve of the thigh supplies the skin of the uppermost part of the medial area of the calf. Posterior cutaneous nerve of thigh, a branch of sacral plexus, supplies the skin of the upper half of the central area of calf. Sural nerve, branch of tibial nerve, joins the sural communicating nerve and supplies the skin of the lateral area of leg and ends at the lateral side of little toe. Lateral cutaneous nerve of the calf, a branch of the common peroneal nerve, supplies the skin of the upper 2/3 of the lateral area of the leg. Sural communicating nerve, a branch of the common peroneal nerve, joins the sural nerve and supplies lateral area of leg. Medial calcaneal branches of the tibial nerve supplies the skin of the heel and medial side of the foot. Cutaneous veins. It includes great saphenous vein and small saphenous vein. Boundaries and subdivisions of the posterior compartment. Boundaries. Posterior compartment of leg is bounded anteriorly by tibia, interosseous membrane, fibula, posterior intermuscular septum. Posterior compartment of leg is bounded posteriorly by deep fascia of leg. Subdivisions. Posterior compartment is subdivided by superficial transverse facial septa and deep transverse facial septa into three parts: superficial, middle, and deep. Superficial transverse facial septum. Superficial and deep muscles of the back leg are separated by superficial transverse facial septum. Attachments. Superiorly to the soleal line of tibia and back of fibula below the origin of soleus. Inferiorly, it is continuous with the flexor retinaculum and superior peroneal retinaculum. Medially, it is attached to the medial border of tibia. Laterally, it is attached to the posterior border of fibula. Deep transverse facial septum. It separates the tibialis posterior from the long flexors of toes. Attachments. Superiorly, it blends with interosseous membrane. Inferiorly, it blends with the superficial facial septum. Medially, it is attached to the vertical ridge on the posterior surface of tibia. Laterally, it is attached to the medial crest of fibula. Contents of posterior compartment. It includes muscles, nerves, and vessels. Muscles. Muscles of the back are classified into two groups, superficial and deep. Superficial muscles. It includes gastrocnemius, soleus, and plantaris. Gastrocnemius. It is a large, powerful muscle which arises from two heads, medial and lateral. Origin. Medial head of gastrocnemius arises from medial condyle of femur behind the adductor tubercle, adjoining popliteal surface of femur, and few fibers from fibrous capsule of knee joint. Lateral head of gastrocnemius arises from the lateral surface of lateral condyle of femur, lateral supracondylar line, and capsule of knee joint. Insertion. Tendon of gastrocnemius fuses with the tendon of soleus to form tendocalcaneus. Tendocalcaneus inserts into the middle of the posterior surface of the calcaneum. Nerve supply. Tibial nerve. Action. Plantar flexion of foot. Weak flexor of knee joint. Soleus. It is a sole-shaped multipinnate muscle. It lies deep to the gastrocnemius. Origin. Soleus arises from soleal line of tibia. Posterior surface of head and upper 3/4 of the posterior surface of shaft of fibula. Tendinous soleal arch which extends between tibia and fibula. Insertion. Soleus fuses with gastrocnemius to form tendocalcaneus. Tendocalcaneus inserts into the middle of the posterior surface of the calcaneum. Nerve supply. Tibial nerve. Action. Plantar flexion of foot. Large valvulus venous sinuses are present within the substance of the soleus muscle. Whenever the soleus contracts, the venous blood is pumped upwards towards the heart. Hence, soleus is also known as peripheral heart. Plantaris. It has a long tendon and short belly. It is vestigial in human beings. Origin. The plantaris muscle arises from lower part of lateral supracondylar line of femur. Oblique popliteal ligament. Insertion. The tendon of plantaris inserts into the posterior surface of calcaneum medial to the attachment of the tendocalcaneus. Nerve supply. Tibial nerve. Actions. It is accessory to the gastrocnemius. It is a weak flexor of knee joint and plantar flexor of foot. Tendocalcaneus. It is also known as tendo-Achilles. Tendocalcaneus is the thickest and strongest tendon of the body. It is about 15 centimeters long. It begins at the middle of the posterior compartment of leg, formed by the fusion of the tendons of gastrocnemius and soleus. It is narrow and thick in the middle. In the lower part, it again expands and inserts into the middle 1/3 of posterior surface of calcaneum. Deep muscles. It includes popliteus, flexor digitorum longus, flexor hallucis longus, tibialis posterior. Popliteus. Origin. It arises from the lateral surface of lateral condyle of femur and outer margin of lateral meniscus of knee joint. The origin of popliteus is intracapsular in nature. Insertion. The muscle inserts into the posterior surface of shaft of tibia above the soleal line. Nerve supply. Tibial nerve. Actions. It unlocks the knee joint. Flexor digitorum longus. Origin. It arises from the upper 2/3 of the medial part of posterior surface of the tibia below the soleal line. Insertion. The tendon of flexor digitorum longus divides into 4 slips for lateral 4 toes. Each slip is attached to the base of the distal phalanx. Nerve supply. Tibial nerve. Actions. Flexion of interphalangeal joints. Plantar flexion of foot. Supports the medial longitudinal arch of foot. Flexor hallucis longus. Origin. It arises from the lower 3/4 of posterior surface of fibula and adjacent interosseous membrane. Insertion. Tendon of flexor hallucis longus inserts into the plantar surface of base of distal phalanx of great toe. Nerve supply. Tibial nerve. Actions. Flexus distal phalanx of great toe. Plantar flexion of foot. Supports supports medial longitudinal arch of foot. Tibialis posterior. Origin. It arises from the upper two-thirds of the lateral part of posterior surface of tibia below the soleal line. Posterior surface of fibula in front of the medial crest and posterior surface of interosseous membrane. Insertion. The tendon of tibialis posterior inserts into the navicular bone and gives slits to all tarsal bones except talus. Few fibers are also attached to the base of second, third and fourth metatarsal bones. Nerve supply. Tibial nerve. Actions. Plantar flexion of ankle joint. Inversion of foot. Supports the medial longitudinal arch of foot. Posterior tibial artery. It is the larger terminal branch of popliteal artery. It begins at the lower border of the popliteus. The artery enters the posterior compartment of the leg by passing deep to the tendinous arch of the origin of soleus. It ends beneath the flexor retinaculum by dividing into medial plantar artery and lateral plantar artery. It is accompanied by a pair of venae comitants. Relations. Posterior tibial artery is related anteriorly. It rests on tibialis posterior, flexor digitorum longus, tibia, and ankle joint. Posteriorly, in the upper part, it is covered by gastrocnemius, soleus, and deep transverse fascia. In the lower part, it is covered only by skin and superficial fascia. It lies parallel to the medial border of tendocalcaneus. Medially, tibial nerve lies medial to the artery in the upper part. Laterally, tibial nerve lies lateral to the artery in the lower part. Branches. Circumflex fibular artery. It encircles the lateral side of the fibular neck and anastomosis with the inferior lateral genicular and anterior tibial recurrent arteries. Peroneal artery. It is the largest branch of posterior tibial artery. It supplies the posterior and lateral compartment of leg. It arises 2.5 centimeters below the commencement of the posterior tibial artery. It descends along the medial crest of fibula between tibialis posterior and flexor hallucis longus. It passes behind the inferior tibiofibular joint and ends on the lateral surface of calcaneus as lateral calcaneal artery. Branches of peroneal artery. Muscular branches. supplies the muscles of flexor and peroneal compartment of leg. Nutrient branch to fibula. Communicating branch which joins with the branch of posterior tibial artery 5 cm above the ankle. Perforating branch. It pierces the interosseous membrane, appears in the extensor or anterior compartment, and forms the lateral malleolar network by anastomosing with the lateral malleolar branch of anterior tibial artery and lateral tarsal branch of dorsalis pedis artery. Lateral calcaneal artery. It is the terminal branch. It contributes to the lateral malleolar network. Nutrient artery to the tibia. Muscular branches to the muscles of posterior compartment of leg. Communicating branch which joins with the branch of peroneal artery 5 cm above the ankle. Medial malleolar branch. It passes towards the medial malleolus and joins with the medial malleolar network. Calcaneal branch. It pierces the flexor retinaculum and supplies skin and subcutaneous tissue of heel. Medial plantar artery and lateral plantar artery are terminal branches of posterior tibial artery. Tibial nerve. Tibial nerve is a branch of sciatic nerve which arises at the upper angle of popliteal fossa. Tibial nerve enters the posterior compartment of leg by passing beneath the tendinous arch of origin of soleus along with posterior tibial vessels. It ends by dividing into medial and lateral plantar nerves beneath the flexor retinaculum. The nerve lies medial to the posterior tibial vessels in the upper part of leg. It crosses superficial to the artery from medial to lateral side in the middle of leg and accompanies the lateral part of posterior tibial vessels in the lower part. Branches. Muscular branches to tibialis posterior. Flexor digitorum longus. Flexor hallucis longus and soleus. Articular branches to ankle joint. Medial calcaneal branch. It pierces the flexor retinaculum and supplies the skin of heel. Flexor retinaculum. Deep fascia of leg thickens in the lower part to form flexor retinaculum. It is about 2.5 centimeters wide. It bridges the deep flexor tendons and neurovascular bundle. Attachments. Flexor retinaculum extends from medial malleolus to the back of calcaneus. Structures passing beneath the flexor retinaculum from medial to lateral. Tibialis posterior tendon. Flexor digitorum longus tendon. Posterior tibial artery with venae commitans. Tibial nerve. Flexor hallucis longus tendon.